Hi, everybody. I'm going to let everybody trickle in, as I always do. And then I'll start my afternoon announcements. All right. Well, I think people will come in as they do. All right. Well, good afternoon, everybody. Welcome to our 22nd annual Cindy L. Dertinger Advanced Breast and Gynecologic Cancer webinar series, Tools for the Journey, every Wednesday throughout October. This year marks an exciting development as we welcome in our gynecologic cancer survivor community, along with those living with advanced breast cancer. And I'm so glad that you could all join us today to learn more about somatic preparation for routine testing with our amazing special guest, Jillian Parkhurst, who is both a certified somatic therapist and a chronic illness doula. We are grateful to M&T Bank that supports coalition educational offerings like this series. Before we begin today's presentation, I always have a few housekeeping announcements to share. First off, closed captioning is available if you click the little CC button at the bottom of the Zoom screen. I will facilitate a question and answer session following the presentation. So as you think of questions during the presentation, type them into the chat function and I'll continue to compile them as the presentation unfolds. And I'll share them at the end with our amazing presenter and we will answer as many as possible before we try our best to wrap up by noon. And just a disclaimer that our presenters cannot give any specific medical advice for any individual case during the short time we have together. So if you could try to keep your questions as broad and inclusive of others as possible, that would be much appreciated. If you want to watch the presentation again or share it with anyone, it's being recorded. It will be added to our webinar library as well as uploaded to our YouTube channel. And I will drop both the link to the webinar library as well as the link to register for the rest of the webinars in this series into the chat for your convenience. And then I'll share the link to follow along with today's slides in there as well. I did send that out in the reminder email, but if you missed it, I'll put it in there. Jillian also shared with me her contact information so that if you would like to reach out to her for some help after this, she also put together a little discount code for anybody who would like to set up more follow-up. Lastly, there will be a survey that pops up on your browser at any point when you leave the webinar. And we do utilize your anonymous feedback when planning our future program offerings. And that's partially why Jillian is here, because we were requested after her January webinar, more, please, and thank you. So I heard you. Here we are. So please complete the survey and help guide me and all of us in the future if you can. All right, today's webinar features a very special guest, Jillian Parkhurst. Jillian is a certified integrative somatic trauma therapist, a chronic illness doula, a culinary nutritionist, health coach, and educator living with multiple myeloma herself. Her experiences with chronic illness, medical trauma, and CPTSD, which stands for complex post-traumatic stress disorder, deeply inform her work, and she understands the emotional weight of navigating the healthcare system, the fear of uncertainty, and the longing to feel at home in one's body again. In her practice, she supports clients in tuning into their bodies, exploring emotions, and completing stress response cycles so that they can make aligned present-day choices rooted in self-compassion and nervous system awareness. Outside of work, she loves learning and sharing, getting creative in the kitchen, and building community. Same, Jillian. That's why we get along so well. You can often find Jillian with her nose in a book. Same. Hiking with her dog Parker, playing in her garden, also same, or near water, her favorite place to recharge. We are so grateful that you could be with us today, Jillian. So without further ado, take it away.
Hi, thank you, Rachel. Thank you all for joining me today and coming to this presentation. I'm really excited about our topic. As Rachel said, I'm an integrative somatic trauma practitioner, illness doula. I specifically work with a lot of folks who are living with or have experienced cancer. And I also come to you as someone who has lived with cancer myself, or who does currently. So I'm thinking you can all see my slides here. I'm hoping.
Looks good to me.
Thank you, Rachel. So I'm going to get in because we have a tight time frame today. So I'm going to share some information with you and I'll infuse it with some body-based practices so that we can break up some of the material and you can be practicing some of that somatic content. Before we start, I just want to share that soma, if this work is new to you, soma means body, and somatic work is being in dialogue with the body. So it's that connection of the mind and the body as one, seeing it as whole. And there's been a lot of research done around somatic experiencing and somatic work in the field of PTSD patients and clients. And they found that adding the somatic component is what helps people make much greater. There's a lot of greater, more long-lasting, profound impacts to the work versus our traditional just cognitive therapy. There are benefits of having both, absolutely. So one is not better than the other, but they have just found that that somatic piece is what's been missing for people because the experiences that we all experience ourselves, the things that maybe happen to us or around us, they live in our body, and we don't necessarily have the ability to articulate what's happening with our brain and our words when some of it is subconscious and a felt sense. So today we'll start to look at how can we use this somatic approach to something that all of us, many of us have experienced, which is that routine testing, Scanxiety, right? So I just want to normalize right up front that you're not alone, right? I personally experience this every 3 months when I have my own scans and my own blood work and biopsies occasionally in there. And they bring up a lot. They bring up fear, they bring up anxiety, some dread, and often they can bring up old memories. So you'll learn about why that happens to your body, why that happens with our nervous system as we move forward. But before we really get into some of the content, I thought we could start with a little grounding practice to bring us all into this moment together. So if you could, if you're in a place where you can put your feet on the floor, if they're not already, I'm just going to invite you for about maybe 1 minute this practice will take. But I want you to place your feet on the floor. Start to slow down the breath a little bit, not changing it or forcing it. Gently closing the eyes if that feels comfortable. And if it doesn't feel comfortable or safe to close them, have like a heavy lidded gaze that kind of just looks down at your lap. And start to bring your awareness to your feet. Do you feel any temperatures there? Maybe you feel hardwood or carpet. Or if your feet are in shoes, you can feel maybe that constriction there. But just starting to bring some awareness to the lower half of the body. Often, especially in medical situations or times of urgency, we default to the brain and we forget we have this entire body. Taking your feet and just gently press them into the floor so you can bring a little bit more awareness and attention by just engaging them, pressing into the floor and release. Do that one more time with me, pressing the feet into the floor and release. Just noticing now, noticing any tingling, any sensations, any itchiness or warmth or coolness, areas of numbness potentially. Just noticing without trying to change anything. And then I want you to just start to allow your exhales to have an audible sound as we come back into our space, breathing in through the nose, out through the mouth. Blinking the eyes without staring at your computer screen, slowly turning your gaze to look around your environment. And just note 5 things. 5 things that you maybe see, smell, or hear. without placing meaning on them, but just noticing and moving the eyes very slowly. Anytime we dart the eyes quickly, the nervous system perceives threat. So right now we're just looking around and telling our nervous system that everything is safe. And we'll come back to the computer screen, joining myself and each other when you're ready. And I want to start by naming this idea of scanxiety, right? This dread or this fear that we may have with upcoming testing, whether it is scans, blood work, biopsies, whatever that is for you. I just want to name it for us, right? So, scanxiety is the anxiety or the stress that we have that's tied to upcoming testing, right? Especially in this case, we're speaking of routine. It can also come up with new testing, but for today, we're talking about routine testing. This can show up in the mind, it can show up in the body, it can show up in our emotions, it can show up all of these places. And sometimes it's conscious to us and sometimes it's subconscious. And I've noticed for myself and my clients that it can begin as early as 2 weeks before that testing. So it's not just something that pops up the day before or the day of. Maybe consciously it does, but subconsciously, some of those cues of scanxiety start 2 weeks before. And so, ways that I start to notice this for myself and recognize it in clients that I work with are noticing somatically, noticing in the body, what are we feeling? Are you gripping? Are you starting to notice increased tension, right? In your jaw, in your neck, in your shoulders, in your face, scowling, right? Without knowing why. Are you holding your breath, snapping at loved ones, having increased irritability? Worrying, having ruminating thoughts or fears, things that play on repeat in the mind, worst case scenarios on loop. Is there sleeplessness, bad dreams, or memories? Fatigue can heighten, brain fog can heighten. Sometimes there can be some victimization that we can feel for ourselves. But all of these things start to come up subconsciously and sometimes consciously. So this is some of, we're just like dipping our toe in. This is some of what can come up with scanxiety. So I want you to think of your last testing, or maybe, yeah, think of your last periods of testing. And I want to know, like, how and where have you felt signs of scanxiety? And if the chat is open, you're welcome to put that in the chat for me to see. I'm not sure entirely if it is. Um, but if not, you can just make a mental note for yourself and write it down. How and where do you feel scanxiety? Or this, yeah, someone has, Sharon has said irritability, definitely snapping at loved ones. It's always our loved ones, right? Tension, good, good. So just reflecting on this right now is something that can help you in the future. It can help you go, oh yeah, I remember we talked about that. And I'll tell you what you can do next. Great. So you can keep adding those to the chat if that feels right for you. So why does this happen, right? Why do scans stir up so much? Because a lot comes back to our nervous system, right? Our nervous system is the body's natural alarm system. So if we understand what's happening in the nervous system, we can start to name it and work with it rather than resist it or try to work against it and suppress it. So in order to do that, there's a few things we need to know. And we'll go over this very quickly. Some of this was in my talk in January in a little bit more depth if you want to revisit that. Um, but scans, blood draws, biopsies, they're perceived as danger by the nervous system. So the nervous system has like one job. It sees what is safe, what is danger, right? It does not have this gray area in between, which most of life is falling in this gray area. It's very binary. Am I safe? Am I under threat? Whether that's perceived or real. So if something is in this gray area, you better believe it's going to fall into danger, an alarm system. So I want you to think of these symptoms of scanxiety and worry as just your body's alarm system saying, "Hey, something's coming up. Help me remember that I'm okay right now. I'm okay right now. We don't know what's coming, but I'm okay right now." So these alarms that your body gives off are fight, flight, freeze, or shut down. Now, there's a lot in here, but we're simplifying it for today. So the body could be telling you through fight response, irritability, feeling anger, right? Tight jaw, clenched fists, not being held up like a fight, but maybe even just down by your side, like, oh, you don't even know why you're clenching them. Flight, we start to have racing thoughts, a little bit of a restless energy. Like, I got to be doing something. I have to keep really, really busy. I'm going to clean everything in my house and organize every drawer right now, right? Um, Shallow breath, forgetting to breathe. And then there's this tricky state of freeze, which is in between sympathetic and parasympathetic, or sympathetic and dorsal, right? It's between fight and flight and shutdown. It's this place where we kind of have one leg in each. And maybe we have some anxiety, ruminating thoughts like, I need to take action, I need to do something, but I feel stuck. That's freeze. And then shutdown is when we feel exhausted and we just collapse. Sometimes we numb, we hide, we disappear. So instead of just talking about all of this right now, let's take a moment to link this to the sensations we feel in our bodies. So again, I'm going to ask you to close your eyes, bring that heavy lidded gaze if you're comfortable. Make sure you're comfortable in your seat. We don't need to be uncomfortable. And I want you to notice what's coming up for you right now compared to that first practice where we pressed our feet into the ground and just arrived. No obligations, no judgment, just noticing. As I start talking about scans and routine testing, and you hear about these things, what are you noticing in your body right now? Has anything shifted with your breath, your heart, your muscles? Are there any areas of your body gripping, tightening, raising shoulders? Notice if your breath has shortened. Noticing if you have a little butterflies or knots in your belly. Or notice if you are feeling this openness and relief in the body, a sense of relief because you're in good company. So normalize without judgment whatever's happening in your body right now. Maybe you're just noticing a cool breeze on the back of your neck, right? Just noticing it. This is your nervous system doing its job. So today we're going to learn the ways that we can work with our nervous system instead of against or suppressing the things our nervous system are telling us. So when you're ready, you can blink your eyes open and just bring a little bit of a shake to your body. Maybe your hands, just your hands, or the whole upper body. Stand up, whatever you need, right? This is your time for your body. And so let's talk about these phases of scanxiety that we can experience. There's the before the appointment, which I think for me personally, this is different for everyone. For me personally, this is the place where I suffer the most. I'm in this mix of trying to deny what's really coming and that it's really happening. I have to go do this again, and the what ifs, right? This is where I suffer the most. And so here are some things that I do to support myself and that you can do to support yourself. And I do this work with clients, but it's just a simple little practice. Now, everything I'm sharing today can be done in 30 seconds or 30 minutes. It's whatever you decide you have the time for. So we want to tend to not just the logistical of before the appointment. Yes, we need to know what are we going to pack in our bag that day? Don't forget water. Don't forget like a sweater or a shawl to stay warm. Maybe I need my mask. I need my notebook to take notes and a pen and a snack, right? We have all of these logistics, planning out what time we'll leave the house. Who's going to drive me? Or am I going to drive myself, right? But then there's this piece of the emotional preparation that I think a lot of us, we discount it or we just don't, it's not normalized in our society to actually pay attention to or think about. So here's a way for you to prepare on the emotional and somatic level. I want you to, in the future, you can ask yourself these questions or write them in a journal or record a voice note for yourself. There's so much power in using your voice. But ask yourself, what do I notice in my body? What worries or expectations are here, right, around this testing? What expectations do I have for how will it go? What worries do I have about how it might, like, about maybe the tech, the situation, the flow of it, or the results? What might I need? What might I need to feel a little bit safer? And what questions do I want to ask? Now, these questions might be for the tech, for the phlebotomist, the nurse, or the doctor. But what ones do I have? And it's worth just jotting them down without limiting yourself. Write as many questions as you have. And then later you can go back and pick what are my top two or three that I need to ask the provider or this person on that day, right? So I'll go guide you all through another practice, a short awareness scan, just so you can see how this might feel before an appointment. And if you want to, again, in the chat, you can jot down a word or two that describe some of what comes up for you. So again, just getting comfortable. If you're feeling a little squirmy at all, you can just bring a little sway, or if you want a little bit of soothing, just bring a sway to your seat. You can place your hands on your chest or your hands in your lap, and this will be about a 2 to 3 minute practice where we're just going to start with a body scan. So eyes are closed or heavy gaze, just noticing, bringing your awareness to the crown of your head. It's the top of your head. Noticing the eyes, any tension in the eyes, the mouth, clenching teeth, the jaw, the neck, the throat, the shoulders, noticing any raised shoulders or slouching shoulders, how the heart feels, maybe closed off, tight, gripping, open, expansive, or at ease, the heart rate, working your way down to your belly, the abdomen, the lower back, the pelvic floor. Notice if you're holding or clenching, invitation to release if you are. The thighs, the knees, the ankles, and the feet. And as you rest here, noticing if any thoughts, worries, or expectations are present right now. Not trying to seek them out, but just noticing if any are trying to pop up. If they are, just acknowledge them. Yeah, I hear you. I feel you. Asking yourself what you might need right now. For the rest of this webinar, what might you need? Do you need a pillow, a blanket? Do you need to take notes or just absorb and listen? Be present. And the last thing, what questions do you have for Jillian, for me, yourself, your care team, your medical team, your support circle, breast cancer coalition, and just jot those down right now. What's coming up for you with this conversation? Jot that down so that you don't glom onto it for the rest of our time together, right? Have that so you know it will be there for later. And on your next exhale, nice, loud, audible exhale, releasing all of that. You can give a little bit of a shake. You can brush some of that off down the arms, release what you were just reflecting on, coming back into our space. And so starting to see how, yeah, there's that logistical preparation, but also what are the emotional needs I have that might need to be met or supported, right? I'm just going to peek at our chat quickly and seeing. Don't want to go back. Yeah, people we have some very big emotions here with Scanxiety. And I'm going to read through a little bit more of these in a moment. So thank you. Keep sharing. So of course that before piece can be difficult, but then there's the during the appointment or in the waiting room, right? There's these little phases that also occur. So I want to share a few body-based tools that you can quickly use while you're in the situation so that it can help bring you back into regulation, meaning back into safety. Regulation doesn't mean calm and collected, right? Well, maybe it can mean collected. It doesn't mean calm necessarily. You could still be afraid and anxious, but come back into regulation so that you're present in the moment to ask the questions you want, to have the conversations you need to have, right? So things you can do in the waiting room or in the appointment room or during your testing, whatever that may be. This is just a few of the options. So you can tap your leg. I kind of like sometimes I put the front of my toes on the floor and then I bop my heel up and down, up and down, up and down. So this is a way to come back into presence of my whole body, not just the brain, bringing it back to the feet and allowing that natural energy that comes with anxiety that's like really a little flighty and boppy. It allows that to express. So right now I'm just doing that, just bopping my heel. If you'd like to, you can. I can push or pull into the chair. I can practice something called straw breathing. And I can orient to the space that I'm in. You oriented at the beginning of this call where we slowly looked around. So that's something you could easily do without people knowing. And you track your gaze slowly across the room and note the things you see, smell, maybe taste, maybe hear, right? Textures you feel. And so we'll do a couple of these practices right now. The push pull I find to be a very effective way to express some of the fight or flight energy we may be feeling. So again, when we're feeling that energy of like snapping, irritable, or we're feeling like we need to be moving around, like something just feels like it needs to move. This can also work for freeze too, that response where we're feeling like we need to take action, but we're stuck. So for push or pull, hoping you can see my chair here. So I'm just, sorry, Bubba, that's my dog, Parker. So I'm going to take my hands and I am just going to press them into the seat of the chair. So I'm going to inhale, press, and you can do this along with me. Press, 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 and hold. And then as I exhale, I'm going to slowly release and come to a moment of just pausing to notice. Press again, inhaling. Press, 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 press. And exhale, release. Conversely, you can also pull, which I think see what feels better for your body right now. So you're grabbing underneath the chair and just pulling up on the chair. And so that naturally pulls your body down into the chair, anchoring you into this moment to feel supported. And release. We'll take one more here. Inhaling, pull up on the chair, hold, hold, hold. Feeling your strength, the strength that you have right now in this moment, and then release. Bring the hands to the lap, pause and notice. Starting to notice here any life that comes back, any tingling or energy or any settling that you might feel in a different area of your body. Notice what that simple act of pushing and pulling can change for you. And now I recognize that this can't be done during all types of testing. So if you're in like a CT or an MRI, some type of scanning where you can't move, you can visualize doing that, imagine that you're doing it, and go through the whole process without actively engaging the muscles. That will help. But you can also come back to the breath. Now, not everyone, breath work can be a little tricky. So if breath work is triggering or upsetting for you, I don't recommend this aspect, but I will give you something you can do. But the straw breath is another option. So straw breathing is breathing in through the nose and then breathing out through pursed lips, like you're blowing through a little, holding a straw, right? So you can try that at home. So breathing in through the nose, out through those pursed lips, extending the exhale. By extending the exhale, you're engaging your vagoventral system, which is naturally soothing and regulating. So that's one way we can work with this in this situation where we can't physically move the body, is coming back to that breathing through out the mouth, exhale like a straw. If you're able to make vocalizations, you could add a hum to that. So it would be breathing in, breathing out through the straw with a hum. Focusing as you're doing that on the vibratory sensations that come through the body. And alternatively, you can take out the straw breathing and just hum and focus on the sensations because this will also engage the ventral vagal system to bring you back into regulation. So that's just a few ways that we can use what our nervous system is doing and we can work with it versus resisting it. So if we're tensing and clenching, I don't want you to force it not to. Lean into that and tense by pushing or pulling for a moment and then allow release because you're telling your nervous system you hear what it's asking for and that you're safe. And it's allowing you to move through that nervous system response without resisting it. But all of this then doesn't stop when the testing is over, right? So we've talked about what we can do before the testing, what we can actively be doing with our bodies during or like waiting in the waiting room after the appointment. There's also this very important aspect of we need to complete a stress response. So if you think of a stress response as like an arc, it goes up and then back down, right? So we start to feel this tension building in the body. For example, tension's building, building, building. And then if we suppress that, we try to ignore it and resist it, it just stays there, right? Or sometimes it gets worse and worse and worse. But if we work with it, we work with that tension, for example, pressing into the chair, oh, there's this natural arc of relief because the body got what it needed. So I want you to think about after the appointment as how can I practice engaging with the activation, engaging with the natural impulse my body had during or after? And then how can I soothe myself and nurture myself? So here's ways to do it. You can shake your body, full on shake, growl, whatever you need. Move briskly, like take a walk if that's what your body's asking for. And you can get in your car and yell. You can press into the steering wheel. You can pound the steering wheel, right? You can basically throw an adult temper tantrum, right? Adult temper tantrums are valid and needed. They're wonderful expressions of what the nervous system is seeking and actively trying to do to move through a situation to remember it's safe. As long as you're doing it in like the safe confines, right? You're not harming yourself or anyone else with it. And there's something called a silent scream. You can try this now if you want to. This is one of my personal favorites. But I take my hands, I make a fist like a temper tantrum, and I press them down and I make my face into the shape as if I'm screaming, and I elicit the same response without sound. So it's I breathe in, and the body, if you do this expression, try it right now. If you do that full expression and you're letting out air through the throat, but you're feeling the sensations of a full scream, oh, afterwards you will feel release. You will feel relief. So trying that. And then after we've done these things, we've moved this energy, we've worked with the energy, we've embraced it versus ignore it, shove it aside. Then we do something to soothe ourselves. We get a tea. We hold a cup of tea and focus on the warmth. We sip it. We meet with a friend. We talk with a friend on the phone. We sit in nature. We lay in a hammock, whatever that is for you. And the last piece here after the appointment is I want you to remember it's never too late. It's never too late for you to try a somatic intervention or a somatic expression. We sometimes think like, oh, I have to race back to work or I have to go get to this thing. And yeah, that's the reality sometimes. So how can you start to incorporate this either in real time in 30-second snippets, or can you, after you finish the day, come back and give yourself a silent scream for that part of you who couldn't earlier, right? So it's never too late. And it doesn't take away the fear or the pain that you have. Those things are very valid, but it does allow you to acknowledge them, honor them, and feel them. So, right now, I would love for you to choose, and you can put this in the chat, you can put this on your piece of paper, just from what I've shared right now. Just write down one mobilizing, one action item, like action that you can take with your body after an appointment. Whether that's shake, move, stomp, walk fast, whatever that is for you. Just write down one thing that you're committing to trying at your next after your next appointment or testing. And then write down one soothing action that you can take after that. It might have to be later in the day, it might be immediately after. What's one soothing thing you can do that you know feels good in your body, in your heart, right? That makes you feel safe, connected. And it can be something I've shared, it could be something that I haven't shared, whatever works for you. But just write that down, make that commitment to yourself. Yeah, a couple of things in the chat here. One says, I have to verbalize to those around me what I'm going through and that I'm really stressed. Just sharing with a caring person, health professional, etc., starts to take out the stress. This is beautiful, and this leans perfectly with where we're going next. I have learned I can't be alone for certain procedures. I'm so happy you know that for yourself, Sharon. Especially a home blood draw and PET CT scans. I always reward myself after an infusion. I like that, calling that soothing action a reward. Beautiful. Have someone rub my back, calms my nervous system, going to work on deep breathing and rocking in a chair. Great. Stretching. Good. We've got shake and remember it's never too late. Yeah, never too late. Breathing. Our breath is always with us, right? This is great. Thank you all. You can keep sharing over there too. So, leaning into some of what Sharon was saying, we've talked about these actions, but I would be remiss if I left out the aspect of our own advocacy. This is all a part of it, right? Because these things are routine. There is something about building up the confidence if we didn't have it before, or the ability to speak up for what we need. As someone in there said, I need to talk it through with a friend or a caring professional. Like they know their need, so they do that. So I think often, especially early on, for myself personally, early on, it feels like there's this hierarchy, right? The medical professional's here and I'm here. I listen, I just do what they say, and I try not to take up more of their time or cause them inconvenience. That's my good girl, right? But as I have gone through this more, I've been living with illness for 12, 13 years now. So I now know what I need a lot more than I used to. And so I want you to see all of this work as a building block for how to advocate for yourself. It's a way that we support ourselves. And the way that we get to here, maybe you're already there, but a way that we can reinforce it is when we are regulated, when we're doing these other little pieces and paying attention to what's happening in our body, our soma, then we can speak up for what we need. But if we are highly dysregulated, in panic and feeling like we're under threat, it's very difficult to speak our needs. We can't judge ourselves for that. We can't expect that of ourselves, right? So here are some examples. Whenever I go into a medical situation now, I have this phrase that I just say, and I just say it like and I get it off my chest and then I can just move forward. Once I say it, I know I've spoken up for myself. So I say, I have medical trauma. It helps me if you verbalize before starting anything and move slowly when possible and use humor. I've even been known to, when I have surgeries, if I'm doing something with like moving into the OR, I've even asked, who's your funniest person who will be in the OR? Because I'd like to meet them before and let them know they can crack all the jokes. So it actually eases the situation for not just myself, but everyone. So whatever those phrases are for you, just let that percolate right now. Do you say anything? Do you ask for your needs? Have you felt comfortable enough to say, I need a break? Can we pause for a second? There was one time I was getting an MRI and I was in full panic attack mode because I was the last one of the day and the techs were moving way too fast for me at that moment. And I felt like I was going to explode, and they put on, some of the straps that they needed to keep me in place. But no one told me they were doing it. They just did it, and it shocked my nervous system. And I started to panic. And I said, take it off, right? And it was the first time, this was a long time ago, it was the first time I actually spoke for what I needed. In the past, I would have endured and suffered, and it would have stuck with me and exhausted me and depleted me. And so I said to them then, I need you to verbalize. That's where I started to go, oh, that's something I need. I need you to verbalize. And I said, I am going to close my eyes and I'm going to take 3 deep breaths. After you have seen this happen, I'm not going to tell you, but after you've seen it happen, then you can do all of the things you have to do to get me into the machine. Don't know what they thought of me, but it worked. It helped me. It helped me get through it because I was able to come back to my body and what I needed. So I want to encourage all of us to be doing this when we can. And I just want to emphasize it is always okay to ask for permission or to ask for what we need, ask questions, set boundaries. And in fact, I have found that the majority of health professionals actually like it. They appreciate it. I've had so many nurses say to me, thank you for saying that, because I'm just in like my routine mode, right? I get into a groove and I don't think about these things. So thank you for saying that. And a lot of nurses too, and medical professionals, for them, if we get past a point of very difficult return, it makes everyone's job harder. It so the more that we can speak up for ourselves in real time or before, the clearer the scans will be, the more effective the whole process will be, the more smoothly it will go, which is not just for them, it's mostly for you, right? You get what you need in that moment. So I have talked a lot and I don't see your beautiful faces and I would love to, but I want us to have a moment before we get into questions and um, sharing some of what's coming up for you to just take what I've just shared. I've shared a lot of information and I don't expect you to retain it all, but I want you to pick something that you can hold on to so that you remember it for future, that you can commit to memory. And I want you to feel into, think about what is one tool that you will take away with you after this call today. And again, write it in the chat, write it on a piece of paper. What is one tool? Or what is one bit of information that really stood out to you, or a realization, an aha that you had for yourself? Write that down. We've got things coming into the chat. Yes, Linda, that is what happened to me. Um, I'm proud of you for speaking up with what you needed, and I'm sorry you experienced that. Straw breathing. Continue to work on this and plan a bit more. Straw breathing. Good. Got some repeats there. So the more that you write these things down for yourself and think about them, the more it will stick in your consciousness and subconscious, right? It's like make a plan today while you're doing okay, and then you can better access it another time. So let's close this whole learning segment now with one more practice. So coming back into closing the eyes, following your breath, not trying to change it, just noticing. You can place your hands on your belly. Noticing the inhale and exhale, how the belly rises and the belly falls. Noticing if that doesn't happen, if you're breathing up into your chest. And if you are, you can invite it to come down into the belly. Good. Inhaling through the nose, exhaling out the mouth. Or taking this moment to practice that straw breath, inhaling through the nose, exhaling out pursed lips. Making that exhale last a couple of beats longer than the inhale. Try that 2 more times. Inhaling through the nose. Nice long exhale, slowing things down. Final breath here, in through the nose, out through those pursed lips. Noticing if your body needs anything else from you in this moment, maybe some gentle neck rolls, not forcing a big stretch, but just gentle neck rolls. Maybe pulling the arms up overhead, extending the arms out to the side or behind you, letting out yawns. Yawns are a beautiful way of like releasing excess energy in the body, inviting a twist if that's what feels right. Just taking what your body needs to come back into our space as we prepare for questions, as we prepare for dialogue with each other. And before we get into questions, I just want to say thank you for being here. These are the tools that I use for myself. These are the tools that I use with my clients. We do sessions where we work with what's coming up in real time and we move through this so that they can better build their own resilience to navigate these difficult things that we all have to unfortunately navigate. And I just want to add that none of this work happens at once. This is all a gradual practice. You know, I've thrown a lot of little tastes of information at you, but it's when we start to practice every day, when in our normal days, when we're feeling okay or crummy or great, whatever we're feeling, just having like a baseline practice that's 2 minutes long, maybe 5 minutes long. So I do have an invitation for you all because this is how we start to build that regulation and safety. And I have an invitation if you're called in any way to try some of this in a low key, low pressure way, I have something called the Continuum. The link is here. It should be in your chat too. And it's just a 2 month thing. I'm trying something new to see if I want to build it into a membership where you will get one pre-recorded practice every month that you can just follow along with. It's 5 to 8 minutes, and you just do it every day, every day. And then there is a chat group for us to talk and ask questions and support one another. And then I do offer 2 live calls in there for us to disconnect in real time for any kind of coaching. So this is a really affordable way to try this work with coaching support and others who are doing it. Use a discount code together for 20% off. That's for all breast cancer coalition folks. So now I want to open this up for your questions. Your questions and reflections are so important. And this, I think, is where a lot of the real integration and learning and conversations come into play. So, Rachel, how do you want to, move through questions here?
Well, I think everybody has been very present, which I think is always,
Wonderful.
um, and has been moving with you through all of these practices. So feel free if people have questions that are sort of
Mhm.
percolating, drop them in the chat
Great.
and we'll go through them. The only question that I had as we were talking is when you mentioned humming,
Mhm.
that is something that I use as well to pulse off big feelings,
Okay.
which I am full of.
My most favorite humans are.
Um, I wondered if ideally when you hum or when you're singing, like you were talking about the straw breathing and adding a tone to it, should those tones be sort of low in pitch, ideally to help keep your breathing in your belly instead of up here, or does it matter?
There's no ideal. I want people to play with it. So what I do with clients is we work on playing with the pitch on lower, where do we feel it resonate? Higher, how does that feel? For some people, higher tones can feel a little bit flighty and like potentially activating. So I think for the majority of people, lower can feel a little bit more soothing.
Mhm.
The frequency there is just very calm, like it's like a balm, a soothing balm in a way. And there's different phrases that we can use for different areas of the body, like our root chakra and other, if people are familiar with chakras, or just areas that you can almost focus on sending. To me, the pitch isn't as important as what you're doing while you hum. And it's like when I'm humming, am I tuning into how I feel it in the body and where, and start to play with sending it to my belly. Can I feel the vibration in my belly, or do I just feel it here? So noticing where that begins and ends.
Okay,
Yeah.
very helpful.
Mhm.
And yeah, still, does anyone else have questions?
No questions. Are people allowed to unmute, or is it all chat here?
Usually we do it all chat
Okay,
because we have 6 minutes left and
great.
it can be tough and challenging for how little time we have together.
Mhm.
But yes, Sharon is sharing that struggling with a lot of similar issues. And I think the
Mm,
wonderful thing about all of the practices and the tools that you've shared is that those can be shared with anybody who's
mhm,
dealing. It doesn't just have to be for routine testing. It doesn't just have to be for anyone dealing with a cancer diagnosis.
mhm,
Those tools are for anyone that is dealing with emotions that come up and fear and grief, um,
mhm,
which I would be, um, I think, pretty confident saying that that's all of us.
mhm.
Um,
Yeah, and I think too with what Sharon has said here, I just want to say with like sensory processing disorder, I also want to normalize something I don't hear a lot in cancer communities I've been in personally. I really struggled after treatment um, with stimulation. So I would get overstimulated very easily because there was so much isolation and right. So sounds were louder, lights were brighter. Yeah, Sharon says yes. So I think a lot of this stuff is what helped me come back. Like I couldn't grocery shop for a very long time. I had to go to PT to learn how to experience the sounds and noises again. So I just want to normalize if anyone is physically feeling those things too. Um, yeah, the Breast Cancer Coalition.
Any tips
I'm
for lowering heart rate when deep breathing isn't entirely working? That's a great question.
That's great. Lowering heart rate. Yes. If deep breathing isn't working, I would come into that humming actually can be really helpful. And I would even come into the heart acupressure with the heart point. So coming in between on the sternum here, in between where nipples would be on the sternum, and just taking your fingers and just pressing here and incorporate the breathing with it. Right? So just focusing here and just pressing into the area. Now, if that's too tender for you, back off a little bit. It's a tender spot, but this can help. And I would also focus on bringing awareness into that lower half of the body. So focusing on where does my back feel against the seat, my where does my glutes hit and come in contact with the seat. And if trying breath work, I'm not sure if you've tried extending the exhale. Extending the exhale will all majority of the time should help lower that heart rate.
How hard were you pressing? I
I'm
don't know. It's easy
yeah,
to explain.
I'm I'm pressing enough that it's not like it's not like just making a contact of a touch. I'm pressing in. So acupressure, think about acupuncture. They're putting a needle into the point to activate the point. I'm doing that without, obviously, I can't put my finger through layers, but I can press into them. So you're pressing pretty firmly there,
Okay, so firm
pretty
pressure.
firm. But if it hurts, some days it might feel more tender. If it hurts, you back off a little bit. We don't want it to hurt.
It shouldn't hurt, but it should be enough pressure that you are noticing it
Mhm.
and able to tune into it.
Yeah, feeling that contact.
Okay.
Great.
Anybody have any other questions? We have 2 minutes
Oh,
left.
2 minutes. Take advantage.
Two
Uh,
minutes. What a luxury.
Questions, anything you want to share from this experience today?
Yeah.
I'm open to all of it.
Does really seem like there's been a lot of sharing about how useful these things are. And
Mhm.
are there any websites you recommend?
Yes. First, I recommend mine because I have to. I'm a human being, you know. No, I do have videos on YouTube. I can share that link with Rachel. Um,
Your
Yeah,
YouTube.
YouTube's. I love Gabor Mate. I don't know if you are familiar with, I'm putting his name in there. If you want to learn more about just, he wrote the book called The Body Keeps the Score. And if, or
Oh,
no, he didn't read, Vander Besselkoek wrote that.
also a good one, but dense.
Yes. So that's the book. I'll write that.
The body keeps the score.
Yes, that's a great book for you to read about the effects of just trauma and holding in the body. But Gabor Mate is a great resource for he. I feel very soothed when I hear his voice. He's very knowledgeable, empathetic human. He's well researched. Yeah, he's a great resource there. And then the last one I would do would be on this is one of my teachers, Dr. Scott Lyons. Just a beautiful human who he's also a somatic practitioner and therapist, and he's really good at like articulating nervous system information. It just really depends on what type of information you're looking for, but those should be good places to start. Yeah.
All right.
And if you're
Well,
on Instagram, I'm continuously I put up like I mean that's free and I put up videos and little action items and educational content. And I would actually encourage you to join my newsletter too. That's what I would say. you can go to my website and add your email address to join my newsletter. That's where I send a lot of free stuff.
Lovely newsletter.
Yeah.
I
Oh, thank you, Rachel.
After
Thank
your January webinar, I signed up, and Jillian includes a lot of prompts for sort of focusing in, taking stock, and little practices in there. So that's a wonderful place to start.
thank you.
Well, Jillian, wonderful as always. Thank you so, so much for sharing your time and your expertise with us and all of these wonderful practices. Thanks to all of you who shared so much with us about
Yeah,
what
thank
you're
you.
dealing with, what you're struggling with. And I hope that these things soothe you and make the process a little bit easier, a little smoother.
I hope so too.
Next week, we're going to be joined by Dr. Mark Swager to talk about psychedelic assisted therapy, healing with psychedelics, a path to well-being, as we continue our weekly webinars throughout October, lunchtime, noon to 1. So I hope to see you all same time, same place. Ta-ta for now. Be kind to yourselves. I'm sending soothing to all of you, you too, Jillian, and to myself. And I will see you all next Wednesday, I hope.
Thank you, Rachel. Thank you, everyone. Bye.
Okay, everybody. Bye.